So, welcome, Speaker Caitlin from NBER. I will give you both a 5 minute and a 1 minute warning during your talk.
Okay, great. So I'm hoping to have 5 minutes at the end for questions. So let's get started. My name is Caitlin Gorback. I'm a postdoctoral researcher at the National Bureau of Economics Research. I'm glad to be here today with all of you, presenting some joint work with Ed Glazer of Harvard University Economics Department and Steve Redding of the Princeton University Economics Department. Our recent work, How Much Does COVID-19 Increase with Mobility? Evidence from New York and 4 other cities. So we're here in a panel studying how COVID and mobility are related using geospatial data. So I'm going to present an opener that many of you are probably familiar with. Here I have just two plots, two time series of travel and new cases or total cases in New York City during the kind of ramp up to the US epidemic over January and June 2020. So one of the kind of conundrums that we've seen in presenting data like this is that as new cases or cases in total have been on the rise, concurrently changes in travel have really plummeted. So this might lead the kind of nascent researcher with just kind of a casting glance at these graphs to assume that there's either a negative or zero correlation between travel or mobility and COVID-19. Now, given the epidemiological ways that this disease spreads through contact with other people, specifically through oral droplets, that is quite a conundrum. However, if you drill down from kind of the city as a bird's eye view to within New York City, you see that this kind of zero or negative correlation between, on the one hand, the rise of COVID and the decline of travel is really not constant in space. So that's to say that lockdowns did not lower uniformly travel across the city. So here on the left, I have the percent change in trips from May 2020 versus May 2019. And on the right, we have a panel of cases per person in New York City as of June of 2020. So if you look in kind of the top of each panel, you see that, for example, the Bronx, residents there did not decline or decrease their travel very much relative to, say, residents in Manhattan or the wealthier neighborhoods of Brooklyn, for example, Long Island City, Queens, or Park Slope or Williamsburg. And in the right, you see that locations that have responded to the lockdowns by staying at home, such as Manhattan, are associated with the lowest levels of cases per person. So while the previous graph looks like there's kind of a negative relationship or a zero relationship between mobility and cases, if you really look within a city, spatially, it looks like maybe clusters of COVID cases are correlated with mobility. So that brings us to our question, where we're asking, how effective are restrictions on geographic mobility in limiting the spread of the COVID-19 pandemic? So the paper is going to proceed in two parts. First, we're going to measure how falls in mobility contribute to the total case count. So this is going to be cross-sectional at one point in time. We're going to use zip codes from the 5 US cities. So New York, in addition to New York, we're going to have Atlanta, Boston, Chicago, and Philadelphia. These were all cities that provided case counts at the sub-city and sub-county level, importantly at the zip code level. All of these case counts are going to be as of June of 2020. And we're going to look at the relationship between these case counts and mobility using data from cell phone trips. And I'll get into that in a few slides. Additionally, we're going to measure how falls in mobility contribute to new cases 2 weeks later. So trips today and cases 2 weeks later, or cases today and trips 2 weeks prior. To do this, we're going to use a panel of zip codes in New York City. So New York City has actually been tracking new cases. You can get data daily. We're going to cover the period from March to June, so pretty much like the first wave of COVID in the US. And this is going to use data not only from cell phone trips, but also subway turnstile entries. Now, the key measurement concern for both of these research designs is that policy and individual travel behavior is responding to the perceived disease threat. So lockdowns follow outbreaks, and people reduce their travel once they observe disease spread. So using the ordinary least squares specification would therefore bias downwards the impact of mobility on COVID-19 cases, as in that first time series, that first slide that I showed you. Like I said, this is because restrictions follow outbreaks and individuals make mobility decisions endogenously based on the perceived threat of infection. So what we're going to do in this paper is we're going to implement an instrumental variables strategy where we're going to instrument for mobility, or the percent change in trips, using the share of essential or teleworkable workers in a given residential zip code in 2018. And I'll get into more details in a few slides. So just to preview the findings, we do find that mobility has meaningfully contributed to COVID-19 spread. So using the panel of zip codes across 5 cities, we find that total cases per capita fall by about 28% for each 10 percentage point decline in mobility. As expected, the OLS estimate is biased downwards. It is smaller by about a third. And these results are robust to including a variety of demographic controls and city fixed effects. We do find that the highest estimates are among East Coast cities. Now that could be because there's something different about East Coast cities, or it could be that, the pandemic really started there. And so for Atlanta, for Chicago, for example, we just haven't followed the data far enough. So in New York City, we find that new cases per capita fall by about 16% to 34%, depending on the trip data that we use, for each 10 percentage point decline in mobility 2 weeks prior. As the graph in the first slide presaged, the OLS estimates are insignificant and clustered around 0, where you see anywhere from a negative 1.7% to a 3% impact of mobility on COVID. And this is because of those endogenous responses of both policymakers and individuals. Now, interestingly, using the SafeGraph data, we find that the impact of travel on cases was higher before cases peaked in early April of 2020. But using the Turnstile data, the impact of travel is actually increasing over time. So I'm going to talk at the end of the paper or the presentation why we might think that that could be. So I'm not going to get too far into the contributions other than to say, obviously, this is not an exhaustive list, and it is admittedly biased towards economics papers. I don't have an IV for that at this time. All right, so let's get into the data. For the outcomes, we're going to look at new daily cases, and in the paper, but not so much in this presentation, total death counts from the New York Public Health Office. Total cases coming from Atlanta, Boston, Chicago, New York City, and Philadelphia public health departments at the zip code level as of June. So for building the instrument, we're going to use data from 3 sources. First, the American Community Survey is going to give us a distribution of workers by industry type, in particular where those workers live. So think about giving me the number of lawyers living in a resident zip code, or the number of auto workers, etc. We're going to combine these with Dingle and Naiman's 2020 industry teleworkable shares. So they give us for any given industry, how likely is it that you can work from home? And we're also going to build an instrument using essential industry classifications from the Minnesota and Delaware shutdown orders. To measure our right-hand side variable, we're going to use travel and mobility data from the SafeGraph weekly patterns data. SafeGraph is a firm that measures for points of interest, say hotels or movie theaters or schools, how many visitors came to that point of interest and where did those visitors come. So we can actually create a variable that is how many trips were taken away from one resident zip code. In addition, we're going to use data from the New York City Metropolitan Transit Authority on turnstile data. So here, trips will be measured by turnstile entries, or effectively subway rides in a given location I. So a little bit different. So the standard research design, kind of the first-hand thing that we do is we're going to try and estimate a relationship between trips and COVID cases just using OLS. For the city panel of 5 cities, we're going to regress the log of total cases per capita on the percent change in trips, controlling for city fixed effects. In the panel design, we're going to regress the log of new cases in a given week on the percent change in trips the 2 weeks prior, controlling for zip fixed effects and week fixed effects. This just allows the fact that COVID has been impacting different zip codes for a variety of reasons that we don't have observable data on, and then that's going to potentially change over time for the city as a whole. Now, as I had highlighted, there are two sources of bias, namely as COVID-19 cases increase, residents respond by decreasing their trips. So this is going to bias the point estimate in the OLS regressions in both 1 and 2 downwards. Additionally, trips and cases are measured with error. We cannot pick up every single trip using this cell phone data or this subway turnstile data. Additionally, especially at this time, it was very hard to get a test if you were not presenting pretty severe symptoms. That's to be said, so beta is going to be biased downwards, and this is going to limit our ability to infer any relationship using OLS estimation. So we're going to build two instruments. First, the share of essential workers. It's the share of workers in 2018 living in location I, designated as essential, and the share of teleworkers. So this is a share of workers in 2018 living in location I who can reliably telework. The relevance condition just means that we need to have a strong first stage where the percent change in trips is correlated with the share of essential workers and the share of teleworkers. The exclusion restriction requires that the share of teleworkers or essential workers in 2018 only affects log of cases or log of deaths through their traveling away from home. So this is just a visual first stage. As we would expect, the percent change in trips is positively correlated with the share essential. So the more essential workers there are, the less they're able to lower their travel from home. And conversely, with the percent change in trips versus telework, the more likely a location is to have high teleworkability, the lower or the more trips are going to fall in that residential location. So now we can move from the OLS to the IV specification for the multi-city IV. Equation 1 moves to 1.1 and 1.2, where in the first stage, we're going to extract the correct or the good variation in percent change in trips by using those instruments and use that instrumented percent change in trips to estimate the relationship between mobility and total cases per capita. Similarly, in the panel design, we're going to instrument for trips with the share of teleworkers and the share of essential workers, but we're going to interact this time varying or correlation in the instrument as well as cross-sectional. So let's get to the results. For the cross-city results, we find that a 10 percentage point decline in trips leads to a 28% decline in the number of cases. So let me walk you through the first row. So in the OLS estimate, we find that a 1 percentage point increase in the percent change in trips, so that means that there's relatively less of a decline, leads to a 0.02 log point increase in cases. So let's multiply that by 100 to get into percent. So you have about a 1.8% increase in cases for every 1 percentage point increase in travel. This point estimate falls in the second column once we start controlling for the share of African American residents in a zip code, their age and their income. And as we would expect, these demographics are correlated in ways we've seen in other research, notably that the share of African American is positively correlated with the case counts and income is negatively correlated with case counts. Now, once we include the IV in column 3, we see that the point estimate pretty much triples, and it's very statistically significant. And even when we're controlling for all of these demographic characteristics, that point estimate only falls to 0.028, getting kind of the title highlight point estimate. Now, breaking this down by city, we note that New York City, Boston, and Philadelphia in the bottom panel seem to have the highest impact of mobility on case outcomes. So like I said earlier, Atlanta and Chicago were not able to measure much very precisely. This could be because we're a little bit too early along by the beginning of June to estimate what's going on in Atlanta and Chicago if their local kind of epidemics started later. However, for New York City, Atlanta, Boston, and Philadelphia, we do see that the change from OLS to IV point estimates go in the right direction, meaning that there were these endogeneity concerns biasing beta towards 0 were ameliorated once we included the IV. Now, for the panel results, this is within New York City, and we're using, again, SafeGraph trips. We find a 10 percentage point decline in trips leads to a 16% fall in cases. So in the first column, the OLS point estimate shows what we would expect from the first slide, where we see a huge increase in cases and a huge decline in mobility. Basically, that there's no statistical relationship between mobility and the log of new cases 2 weeks later. However, as soon as we instrument for mobility with the share of teleworkable and essential employment, we find that the impact of mobility on log new cases is quite significant. A 10 percentage point decline would imply a 38% increase in the log of new cases 2 weeks later. So once we start including zip fixed effects and really beating up the New York City data, we lose some statistical power. However, the point estimate is still going in the right direction, especially when we include the shared telework instrument only, which is a lot more powerful specifically in the New York City scenario.
Oh, there you go.
So,
4-minute warning.
Okay, thank you. So, sorry. So the SafeGraph trips data, the impact of mobility is changing over time. It seems that SafeGraph trips, so trips measured away from home, were particularly important during the ramp up of the epidemic, where the IV point estimates for the first half, from about March to early April, are much higher than the impact on the second half. Perhaps as people start adopting mask wearing or the density of accident cases is lower. We certainly know a lot of people have left Manhattan. However, using the Turnstile trips, we find that the first half of the epidemic in New York City, we're finding the impact of mobility is actually increasing over time. So the point estimate rises from 0.035 to 0.059, and that could be because people using public transit are more likely to have been exposed over time. That's the kind of the cumulative case rate rising. Additionally, the sample of Turnstile zip codes are much more heavily traveled than the average New York City zip code. So there's definitely some more research necessary here. So just to conclude, our results, we believe, are supporting of the lockdown's aims. So we find that COVID-19 does spread with mobility. Because of the endogeneity concerns about behavioral responses and policymaking being reactionary to outbreaks, we implemented an IV strategy to mitigate these concerns. And we find that both across 5 major US cities and within New York City, for each 10 percentage point decline in mobility, we have somewhere between a 16% and a 34% increases in case 2 weeks later, or total cases. So these results just remind us that for people whose jobs required them to leave their houses more, they were more likely to get COVID-19, and at least in New York City, they were more likely to die. So I look forward to your questions and comments.
Okay, so we have one question from William Ratcliffe, and that is, how do you handle uncertainty in the case data for your OLS, or do you assume no uncertainty?
I'm not sure what you mean by uncertainty. Is it about the agent's uncertainty, so travelers or policymakers? Could you clarify that?
Well, he did clarify further with, how do you determine your epsilon_I?
Okay, so epsilon_I is our error term. So for now, what we're doing is pretty standard, robust standard errors. We don't have any kind of clustering or any structure placed on those error terms at the moment. Yeah, it's a pretty reduced form, kind of blunt research design.
All right, you got about 45. Oh, you have about 45 seconds left.
Okay, great.
Anything you want to say?
Yeah, I can take another question.
There's one. It's perhaps kind of speculative.
Okay.
Is this really related to more mobility or poverty, from Iris Cheng?
Great question, Iris. So we had the same concern. So in many of our specifications, we're including local income as one of the controls. I didn't report this in any of the IV instruments, but we're including in these demographic controls local income. That being said, I don't know individual income. So everything's going to be aggregated at the zip code level, but it does seem that there's something in addition to income, in addition to race, in addition to age, that is really operating through people having to travel away from home for work.
All right, very cool. Thank you very much, Caitlin.
Great, thank you.